Hi, my name is Tyler Carter, and I will be talking about the primary and secondary immune responses. Before I get into that, I would like to give a brief overview of the initial immune response to a pathogen. So, this begins with a pathogen breaching the physical barrier to infection. Now, that's an example of that would be skin. And when the skin is breached, it is engulfed by a phagocytic cell. Now, this phagocytic cell attracts other immune cells, white blood cells, things like that, using cytokines and chemokines. And that influx of fluid and blood and all these immune cells causes the inflammatory response. Then these phagocytic cells take the pathogen and migrate to a lymphoid structure where T and B cells are introduced to this pathogen for the first time. Now, these they're lymphocytes with pathogen-specific receptors, and they are selected to proliferate. And that is what begins the adaptive part of the immune response. The lymphocytes used are antigen-specific T and B cells. And in the case of B cells, they differentiate into either effector cells or memory cells. And the effector cells for B cells would be plasma cells, and they become factories for antibodies. What they do is they pump out tons of antibodies into the blood vessels, and they circulate all around the body. And then they find these pathogens and stick to them. The T cells also they're also memory T cells and whatnot, but T cells specifically do not release antibodies. Now, lymphocytes and antibodies exit the blood vessels and enter inflamed tissue and interact with the pathogen. These antibodies and T cells attach to the target pathogen and attack it. This destroys the pathogen. This eradicates the infection. And then what the immune system does is it leaves behind memory lymphocytes, like I spoke about earlier. And these memory lymphocytes make it easier for the immune system to respond to a subsequent encounter with that same pathogen. So I'm going to talk about the lymphoid organs now. The primary lymphoid organs are the bone marrow and the thymus, and that is where immune cells develop from immature precursors. And then the secondary lymphoid organs are the spleen and lymph nodes, and that is where antigen-specific lymphocytes encounter antigen and begin to differentiate into effector memory cells, which I also spoke about earlier. Okay, now let's speak on the primary response. The primary response results from the immune system encountering the pathogen or an antigen for the first time. And the immune system is required to identify it and create cells to inhibit it or kill it. Now, the cells that respond to these antigens are naive B and T cells. They have not encountered this specific antigen before. Now, there is a very long lag period in the primary response, and the lag period in the primary response is more or less the time required for naive B and T cells to proliferate and differentiate, specifically how long it takes B cells to differentiate into plasma cells and fight and release antibodies to fight the infection. But even though the lag period is generally about 4 to 7 days, it can be much longer than that, depending on the specific pathogen or the immune system. In primary response, it takes a lot longer to establish immunity to the pathogen because of the things I just listed. In primary response, the antibody IgM is seen in a lot larger quantities, but there's also small amounts of IgG. Now, in the primary response, a lot less antibodies are produced to fight the pathogen. And then after the infection, these antibody levels decline rapidly. Antibodies in primary response are more specific but less avid, and avidity in the immune response references overall strength of an antibody and antigen complex. And then antibody affinity is lower but more variable. Now, affinity would be the strength of interaction between an epitope and the Fab region of an antibody. And I'll speak on the inflammatory response in the primary, or the inflammatory response, in the primary response. Inflammation is very important to the primary immune response because it slows down progression of pathogens. It stops them at their entry point and causes them to, allows phagocytic cells and immune cells, white blood cells, to halt their progression through the body and allows you to create an immune response to them. In the primary response, the inflammation is caused by an influx of white blood cells in the affected area. White blood cells should be with a U into the area due to the cytokines and chemokines released by the phagocytic cells that engulf the pathogen. Inflamed tissue indicates an immunological response taking place. So the lymphocytes recognize this and flock to the tissue in question. In the top left corner, I actually have a diagram of what it looks like when the physical barrier to infection, specifically the skin in this picture, is breached, and it shows how the phagocytic cells and macrophages and whatnot engulf these pathogens. Now I'll speak on the secondary response. The secondary response occurs when the host organism is exposed to the same antigen again. So now the immune system is prepared because of the memory cells that were left behind in the primary response, and they can immediately make antibodies to counteract this infection. The responding cells are memory B and T cells. There's a very short or non-existent lag period in the secondary response, and in the secondary response, the lag period refers to the time it takes for clonal selection to occur of memory B cells. And then when this clonal selection occurs, these memory B cells are they proliferate, and they create a large population of memory B cells which creates an immunity to the pathogen. Also this short lag period means that you usually won't see symptoms when there's a secondary response to a pathogen. You can, but it's rare. Often it doesn't result in any kind of symptoms to the host organism. It takes very little time to establish immunity to the pathogen. In the secondary response, the IgG antibody is created in large amounts and produced at high levels. But there's also slight amounts of IgM, and in some cases there's IgA or IgE produced. And IgE would be in the case of allergies. The number of antibodies produced in the secondary response is 100 to 1,000 times more than the primary response. The antibody levels remain high for an extended period of time after the infection to, make sure that the infection is gone and taken care of. The antibodies are less specific but more avid, and antibodies have a higher affinity in secondary response. Clonal selection in the secondary response is extremely important. So clonal selection would be the process where B and T cells recognize an antigen and then are selected from a pool of other cells with differing antigen specificities. Now, the selected T and B cells are reproduced, they proliferate to create a large clonal cell population, and this helps them destroy the target antigen or pathogen. This is extremely essential in the secondary response because the cells to fight this infection already exist. So they just need to be selected for reproduction. And then, of course, memory B cells undergo differentiation again into either plasma cells or memory cells, but there aren't any memory cells. So when they undergo differentiation into plasma cells, they can create large numbers of antibodies. The primary and secondary response in the world. This is very important to how we combat infection, because vaccines are a perfect example of the primary and secondary response. Specifically, medical professionals use their knowledge of the primary and secondary responses to create vaccines that combat infection. So what they do is they take either a weakened or dead version of a pathogen, inject it into the body, and allow the immune system to create a response to it. And by doing this, it allows the immune system to forego the initial response to a, say, stronger version of the pathogen, and allows it to immediately create a secondary response. So by this, the immune system goes through a much more mild version of the primary response. And then memory B and T cells are in place to provide a secondary response to subsequent invasion of that specific pathogen, which is very important because it allows us to eradicate pathogens that used to kill tons of people. Now there's a secondary response that stops this. And then, of course, vaccines basically just manipulate the immune system into creating a lasting immunity to specific antigens. Alright, thank you.